Welcome to The Explainer. Today, we're looking at a community's plan to handle public health crises.
A sovereign tribal nation has a legal code that answers this very question. So, let's dive in.
The code's purpose is crystal clear: protect the community's well-being above all else.
This framework gives officials the power they need to act decisively during a health crisis.
It all starts with defining the specific nature of the health threat. Let's break it down.
First, you've got an epidemic. That's when a disease is spreading way more than anyone expected.
Then there's the carrier, someone who can pass the infection on even if they feel totally fine.
But here's the real kicker. When a carrier becomes a health threat to others,
The code is super specific. It lays out 3 clear conditions that define this kind of threat.
So what happens then? Well, the first step isn't punishment. It's a direct order to cooperate.
It's a clear 3-step process. This mandate is a legal requirement to follow all the health guidelines.
And if it's an emergency, they can just tell you. But a written copy has to follow.
Right. So what happens if someone just says no and refuses to listen? That's when things get serious. The health official can take it straight to the tribal court.
And this isn't random. The petition has to lay out all the facts and all the evidence. And here's a big one. If you disobey, you're on the hook for the cost of enforcement.
And the penalties are serious. Willfully disobeying can mean up to 90 days in jail.
On top of that, there's a potential fine of up to $500. Or you could get both.
So you can see the progression, from simple guidance all the way to a final court order.
The Hannahville Code is one community's answer to a massive question every society has to face.